Hello everyone. Today I will be discussing about a component in general physical examination specially related with cardiovascular system. That is, when we mention about the head to toe examination in cardiovascular system, we will be commenting there are no signs of rheumatic activity, there are no signs of infective endocarditis like that. So today our focus should be what are those signs which we are going to see. That is, signs of rheumatic fever or rheumatic activity. Here we all know that there is a named criteria for rheumatic fever, that is Jones criteria, and the features of rheumatic fever will be remembered with the same name, that is Jones. So J for joint pain. So mainly there will be arthritis. This O stands for O-shaped heart, so that it implies carditis. So O-shaped heart implicating carditis, mainly it will be pancarditis. So all three layers of the cardia will be involved. So it is pancarditis. Then N stands for nodules, that is subcutaneous nodules. E stands for erythema marginatum. And S stands for Sydenham chorea. So this is the thing. Now, when we look for the peripheral signs of rheumatic fever, we mainly observe for arthritis, nodules as external marker in head to toe, and erythema marginatum. Sydenham chorea and O-shaped heart, that is the features of carditis, will not be considered in head to toe examination. So we will discuss about these three things mainly. Now we have to know what will be the proper explanation of all these three things. So we told that there will be arthritis. Here things to remember are, it will be involving large joints, and the joint will be swollen and red. So to repeat, usually it will involve large joints, joint will be swollen, red and tender, and sometimes because of repeated attacks of rheumatic fever, joints might get deformed, leading to Jacob's arthritis. So these things should be observed when we are considering the external markers or signs of rheumatic activity when it comes to joint. Then regarding nodules, that is subcutaneous nodules, mainly these will be firm and non-tender, and the distribution of these nodules will be commonly in the extensor surface. So extensors of knee, elbow, etc. So these nodules will indicate these are related to rheumatic activity. And finally, erythema marginatum. So here we can see some round to oval skin lesions with central pallor and reddish margins. So round to oval skin lesions with central pallor with the margin will be red, and these will be distributed in the trunk area and proximal extremities. So the site of distribution will be trunk and proximal extremities. These will be non-itchy. Lesions will not cause itching, and there will be central pallor. That's why the name erythema marginatum. The margin will be reddish in color. So if these are present, we can consider it as a sign of rheumatic activity. So when you are mentioning, always you have to know how these findings will appear. Then only you can mention about the presence of signs of rheumatic activity in head to toe examination of the cardiovascular system. Thank you.